Hello, my name is Mandeep Badial and I'm representing AHVID UK. I have worked in pharmaceuticals for over 15 years. During this presentation, I will be explaining who AHVID are, our activities, introduce some of the victims harmed by HPV vaccines, discuss the health agency's response to the victims, and then final thoughts. This slide explains the formation of our UK Association of HPV Vaccine Injured Daughters. In support of our UK Association, there is a Facebook group, Parents and Sons, Daughters Suffering Long-Term Side Effects Following HPV Vaccination, which is an established group of families whose young people have suffered adverse events following vaccination. Members are from countries worldwide who give each other valuable support and comfort in times of crisis. They understand what the families are going through and they share their experiences, good and bad, giving comfort and advice to one another when required. They have become an international family, doing their best to cope when the world outside ignores them. Their aim is to be there for one another. As at December 2017, we have 503 UK families with injured girls, and that is 503 sick UK girls that we believe is only the tip of the iceberg. Our goals are simple: to protect the injured children and find treatment protocols to help them recover. Try and prevent further injuries and make parents aware of the potential risks involved with HPV vaccine use. Our aim is to give support to one another, raise awareness of the dangers of HPV vaccines, to highlight how these vaccines, in our opinion, have caused serious health injuries for many girls in the UK, to get our governments and the medical profession to realise that thousands of girls worldwide are suffering from post-vaccination disorders, to reassure our members that they are no longer on their own, and by working together, we can achieve greater goals and gain support. To highlight that UK parents are being advised by medical professionals in that many cases their daughters' illnesses are either psychosomatic or coincidence, and yet these young people were all fit and healthy prior to vaccination. We wish to establish proper, in-depth investigations into why healthy and very active young girls are experiencing personality changes and multiple health events following HPV vaccination. We ask that girls and their parents in the UK are treated with greater respect. We are believed and given the opportunity to be healed within our own National Health Service, because this is not occurring at the present time. And to highlight and request the Department of Education to investigate the great loss of education which has occurred following HPV vaccination, and to recognise that all these affects the whole family who experience high levels of stress and in many cases financial loss since their daughters became ill and after they received this vaccine. Please see photographs of some of our family members. This only represents a small section of our association, but these are real people, real families who all share one thing in common with the Japanese families. Our daughters became ill following HPV vaccination, and these illnesses they've lasted for many years. We will now be watching a short extract from the video Sacrificial Virgins. This video, on March the 4th, 2018 in Brisbane, Australia, was awarded the prestigious award of Best Festival and won the Watchdog Spirit Award in recognition of the investigation In Search of Truth and Justice by filmmaker Joan Shenton and her colleagues, notably director Andy Rees and film editor Ollie Richards.
Ruby was a lively, active teenager until she had her first HPV injection.
After my first injection, I experienced dizziness. So I'd stand up and I would faint or I'd black out. After my second injection, I fainted and I went snow white. And I experienced troubles eating. I could only eat a small portion and it would hurt when I was eating. And then after the third injection, I experienced chronic pain in my stomach, in my chest and in my back, and also chronic fatigue and nausea.
Chloe had her first injection when she was 12.
I was a very healthy 12-year-old. I did everything what a preteen girl would do. I'd go to the cinema, I'd skate, I'd go rollerblading. I literally took every opportunity on, like I was dancing constantly, like 6 days a week. I started to become ill after the second injection, and that was around January 2011. It started off with joint pain, muscle pain, bone pain, relentless fatigue which would not go away without sleeping. I used to fall asleep in lessons, and then it kind of escalated from there.
Chloe's condition has gradually worsened, as her mother Sophie explains.
She can't eat anything at all, she can't even swallow, she can't even drink. She's fed through one of her tubes, and she's relying on 22 to 24 hours fluid through a central line. And that's ongoing. You have to keep making up the feed throughout the day and hanging it up and connecting it to her, so that's throughout the day. So
And who does it?
Me. So sometimes through the day is all you do is put up feed and medications, and also once a day you have to disconnect and connect her central line, so that's at a certain time through the day, so that's all day long. So and then in between that you've got to try and do other normal family things.
With this mounting evidence of injury from the HPV vaccine, why are young girls repeatedly being told that their problems are psychosomatic, all in the head, and given psychiatric diagnoses?
I went to one A&E and the doctor took me to the side and said to me, teenagers are a different species, they're from a different planet, their pain is not real, just take her home, send her to school tomorrow and everything will be fine. And I said to her, no, excuse me, this is my daughter, I know what my daughter's like, and my daughter is in agony at the moment.
Nobody ever knew what was wrong. We all had, it's all in your head, it's all make-believe, you've got to just get over it and get on with it, basically. But she kept getting worse, and we did get on with it. We'd never get over it.
Most doctors won't even consider that it would be the injection, but 2 doctors have said that the injection has caused this with me, but they won't write it down, so it won't be in my records. So it's very difficult for all the other doctors to believe us when we tell them that they have agreed.
How does that make you feel?
Quite angry because the injection's still being given out and other people are still getting ill. And we're all getting put down the psychiatric route.
If you know that family, and know the child and have known them for years, and know their medical history, why would you suddenly point the finger and label that child with having a mental health disorder when there's no history of it in her medical records. That is the problem.
Generally, the whole medical professionals and the government just completely wipe off the fact that people are vaccine injured because they are totally worried that they're going to lose their job. There was a time where I did die, but I came back to life and I was ready. I knew that moment I was ready to carry on. I needed to let the world know what truly happened, and that's why I'm here today.
Okay, my personal experience with the HPV vaccine is with the impact it has had on my personal life, my daughter, and the problems it caused. She was very active and a bright girl who was predicted A grades in her exams. She was in the UK's most prestigious Indian Classical Dance Academy. After the Gardasil vaccine, she developed a multitude of symptoms ranging from migraines, twitching in limbs, chronic fatigue. Her third injection, within 2 months, she had her first tonic-clonic seizure in the bathroom while getting ready for school. The symptoms progressed to such an extent she was unable to dance. She was predicted D grades in her exams and she couldn't concentrate in class. She would sleep from 14 to 16 hours a day. An EEG from Oxford Hospital confirmed juvenile epilepsy. This is Nicole El-Safdi, who was fit and healthy, an aspiring dancer. She became totally paralysed after being given the Gardasil vaccine. Her story echoes concerns raised by thousands across the world. This is Zara Beatty, again a sporty, healthy girl who was to fulfill a promising career as a football player. She was given the HPV vaccine, after which she suffered heart palpitations, severe pains all over her body, and says, "I would rather be dead than like this." Her mother says Zara is an 80-year-old in a teenager's body. We have a yellow card report system which is similar to the USA's adverse events reporting system. And approximately 858 doctors or specialists have consulted. Only 13 offered to raise a yellow card. 89 families were not even aware of the reporting system prior to the time of vaccination. 7 health professionals refused to raise a yellow card. Over 90% of families were not even made aware of the yellow card system. Information was ignored from AHVID's questionnaire by the MHRA. Assumptions were made that health professionals will use the yellow card system to promptly report any suspected adverse drug reactions, as it is a spontaneous reporting system. It is an established way for monitoring drug safety. At the start of the Survirix program, the MHRA issued guidance to encourage reporting, and it was given a black triangle status, implementing a strategy of proactive enhanced surveillance via the yellow card scheme. The Joint Committee on the Vaccination and Immunisation, JCVI, advises the UK health departments on immunisation. Professor Andrew Pollard, chair of the JCVI, is known to have advised that side effects to the HPV vaccine might occur within 2 to 3 days following immunisation, but not after 28 days. However, the vaccine manufacturer, GlaxoSmithKline, recognise there are well-known examples of adverse events which can take years to develop or present in the next generation. The HPV vaccine was given in 3 doses, the second after 1 month and the third after 6 months. Although some of the girls in the AHVID questionnaire had serious adverse reactions immediately after the first dose, others had reactions to the second or third dose. Some did not have reactions for days or even months after. The National Guidance for Diagnosis of Chronic Fatigue Syndrome, ME, requires that symptoms have persisted for a minimum of 3 months before a diagnosis. So that only leaves a 3-month window, not 1 year after vaccination. "80% of the girls were initially told by health professionals that they had a psychological illness, including 40% being told, 'It's in your head. It cannot be the vaccine. It has been clinically trialled and declared safe.' Even though the parents insist on assessment for chronic fatigue syndrome, ME, postural orthostatic tachycardia syndrome, and chronic regional pain syndrome, diagnosis has typically taken 3 to 6 years, even though in most cases there was an immediate onset of symptoms and presentations. The Donegan and UK Medicines Health Regulatory Agency study classed adverse event reports after 12 months of the initial dose of vaccine as not being due to the vaccine, which is a totally flawed assumption. A joint European petition has been submitted by Spanish lawyer Francisca Almodovar in December 2017 on behalf of the 3 associations of 3 different countries: Spain's AAVP, UK's AHVID, and for Ireland, Regret. Our aim is that every parent and every child should have the full facts in order to make a truly informed decision, as we are only told that the vaccine is safe and effective, and the patient information leaflet is very rarely provided. AHVID has participated in a 3-part documentary, Sacrificial Virgins, which we have just screened a clip of earlier. It has had a combined viewing of over 85,000 views on YouTube and won 2 awards in Australia, so it's definitely worth watching the videos. The vaccine manufacturer of Gardasil, Merck, highlights that 0.8% of the individuals who took part in the clinical trials reported a serious systemic adverse reaction, and across the clinical trials there were reported 40 deaths. During the UK parliamentary questions, the MHRA identified 3,038 number of serious reports, which is 34%. With reference to the UK vaccine serious adverse events reported by yellow card to the MHRA between 2008 and 2015, there were significantly more adverse events than any other vaccines on the national programme. 22,980 adverse reactions in 8,936 reports, including 8 deaths. We have a quote from Dr. Sin Hang Lee, which highlights the facts that the cost of the vaccine to protect against cervical cancer does not make sense. As the UK average female life expectancy is 82.8 years. The information from cancer research shows that the UK peak age of cervical cancer is 85 to 89 years, and the trend for cancer mortality has decreased by 72% since the 1970s. This is the UK AHVID committee members, and we are thankful to Medwatcher for the opportunity to highlight the issues that our organisation encounters in the UK. We have best wishes to all of the HPV vaccine injured girls and their families in Japan, and we thank all of the professionals who have made it today. Thank you.